doctors, nurses, and EMTs of Reddit. What is your best "how are you not dead" moment? Guy was working at a factory. Somehow there was an accident and a 2 inches wide 3 longboard got shot through his head. Entered through tip of his nose and exited just below his skull on the right side. Face was a mess. Came in from another hospital intubated to see if our neurosurgeon could remove the board. We all assumed he was likely neurologically devastated permanently. We cut down the board and took him to CT to see what we were dealing with. As we were waiting for CT to result, we realized Guy's sedation had worn off and he was awake and could follow commands. You couldn't tell he was awake because his face was so swollen and macerated. We quickly reseated him. Turns out board missed nearly everything important. Messed up his internal carotid and lateral mass of C1 vertebrae. But missed his spinal cord by about 2 millimeters. He walked out of the hospital 5 days later after several big surgeries to fix his face and itch. Neurosurgeon said he'd have a crooked neck forever but otherwise would be fine. I was a nurse at my county's prison. The area was having drug busts every 2 or 3 days it seemed. We get a batch of 10 in and everyone cleared perfectly except for this one woman. She was nodding in and out of consciousness and slurred her words. So I get one of the COs to obtain a urine sample to do a spot drug test. Sure enough, the whole test lit up. So she's placed in detox for a few days and then we would retest her. A few days pass and she's not getting any better, in fact she got a lot worse. So we drug test her again and the test came back positive for everything from THC to benzodiazepines. I have the COs search her thoroughly in case we missed something and sure enough this lady had 2 extra large condoms stuffed up her jail purse and they both were torn open and her vaginal canal was absorbing all those drugs. We counted a total of 200 pills she was carrying. By all rights this girl should have been dead but she recovered after that. Worked as a phleb tech in a hospital for a while. Craziest thing I ever saw was this guy that came in having overdosed on drugs. What drugs, you ask? Literally all of them. Alcohol, cocaine, MDMA, opioids, benzodiazepines, K2, and a myriad of other things. I went to draw his blood for some tests and he asked me if I could get him more drugs from the nurse. I told him he would need to talk to the nurse about that. I ended up having to draw blood from the palm of his hand because his veins were so shot. It was a fun night. Sorry for the long read. I'm an EMT in a really diverse area. We get toned out for a GSW, with no updates. My squad runs 2 ambulances on all GSWs, I was on the backup truck. We get on scene and see a large crowd of people all screaming and crying. The cops point us to this kid who is holding his hand in his face. He has no obvious injuries, until he look up at us. Blood just started to pool out of his head. This kid was shot in the face but was still able to talk to us. He was losing an unhealthy amount of blood, so we very quickly got him in the truck and called for a helicopter. As we are loading him in the back he asked us, "Why am I alive?" Those words stick with me. No one had an answer for him. We quickly start bandaging the wound. It's a small hole right above his eye. We can't find an exit wound and suspect the bullet is still inside of his head. He is bleeding so much that any piece of gauze is immediately soaked. We get a trauma dressing on the wound and it's barely working. Medics arrive and start with their IVs and fluids. The helicopter finally arrived and we were able to ship him to a good hospital. We later find out that the kid was shooting a rap video of his friend on his phone when the gun went off. The bullet traveled through the phone, struck him above the eye and started to bounce around in his head. The bullet exited below the kid's eye. We didn't see that hole from the amount of blood. When we packed the trauma dressing it applied pressure to both wounds. The kid is expecting to make a full recover but will most likely never see out of the tie again. I think about that kid a lot. I hope he is doing better now. I was having problems with my heart racing at irregular intervals. 24 times a year or more, thought it was normal. Till one day it happened at work and I collapsed. Can't carry gear upstairs when your heart is beating so fast it can't pull oxygen from your lungs. Boss made me see a doctor. They put me on a take-home heart monitor to see if they could catch it happening, and eventually they did. Went in to see the doctor and I don't think I ever saw a medical professional so freaked out looking at a chart. I got scheduled for surgery pretty quickly after that. Edit: I don't remember what the problem was called. They described it as an extra bit of electrical wiring in my heart that was causing the problem. They went in and burned that all out with lasers. I'm fine now. Edit: to supraventricular tachycardia is what it was called. I went and looked up my old medical records because a lot of people keep guessing what it was, and that was what it was called. So for those people who guessed SVT, you win internet points. My mother stabilized the neck of a drunk teenager that fell 40 feet out of a tree. He landed on a rock face up and split his skull in half. I met him years after this incident, and had to get a metal plate on his skull. My mother described holding his neck and said she had to hold back vomiting because of how the back of his head was mush. Her gloved hands basically were holding a pile of shattered brain, bone, and skin, yet he was alive. She met him and said she was happy she could help, but told me later she was sad he turned out a moron, still fully functioning but a barfly. Nurse in a clinic in a rough area. Well, for us lots of street people, drug seekers, refugees. In comes a dude for regular checkup and I notice that he had a blood streaking down his face, not fast but definitely something there. So into the room we go, with his wife, and off comes the hat. Now he had had a TBI and lost about half his brain and chunk of his skull, so there is definite issues with cognition. Add that his wife is an addict, life isn't too great. Anyway, off comes the hat and out rolls the most unholy smell of rotten meat. Turns out that incisions on his scalp had become infected. As the infection progressed, he had necrosis of the wound and the wound edges became separate. So this dude had necrosis of his wound and now I could see sections of his brain matter and rotting scalp. A definite holy shit moment. Dude ended up going to the hospital and getting treatment and skin grafts. Is still around. Thank you for watching all the way to the end. If you were at all entertained, please consider giving this video a like and subscribing for future content. Stay safe everyone, until next time.